Okay, we have an incredible story, follow-up story, and a diabetic for 7 years. Now can eat pound cakes and pie. And but even more incredible that you have had pain since you were 12 years old.
Yes, I got the arthritis, gouty arthritis,
Mm-hmm.
the gout,
And rheumatoid, yeah.
and rheumatoid.
Yeah. Mm-hmm.
And I started playing the piano when I was 7. Then I had to stop taking lessons at the age of 12 because they were like paralyzed, and deformed.
At 12 you stopped.
Yeah, I started and I had a lot of pain.
So you haven't been able to play since you were 12?
No, I had to stop for about 4 years.
Mm-hmm.
I went for physical therapy and for some electrical thing that they put.
Mumbo jumbo waste of time.
And steam baths.
Mm-hmm.
And then I was able to play. I was 16 when I started lessons again.
Mm.
And I've been
So
playing.
it did help you a little bit.
Oh yes,
Yeah, okay.
yes. And I was getting more flexible. I was able to play, but I couldn't reach. To this day, I couldn't reach the octaves.
Mm.
I
So
had
when
to
were you
improvise.
when you had to stop again? Were you able to play all this time? You told me that
when
you
I
haven't
was-
played for a long time.
I hadn't played for a long time.
Until Dr. Elain treated you.
During my pregnancies, I had a lot of pain.
So how long were you not able to play? How many years before Dr. Elain treated you? 3 years ago.
Let's see, I didn't play regularly till maybe, I've been coming here going on 3 years.
Yeah, so before 3 years ago, how long a stretch did you were not able
I
to play?
would say for about 20 years.
20 years?
20
Okay.
years I didn't get to play
Yeah.
that often because they were too stiff.
Yeah. You also said that you were cold all the time. Cold,
Yes,
yeah.
yes.
Cold weather,
I
yeah.
always wore boots and even summertime. And
Okay.
I wore gloves,
Oh.
all the time, all the time.
Preparing for skiing in the summer?
And then we did go to the mountains, to Mammoth,
Yeah.
and oh my God, that was, my hands would just freeze, but I had the heavy gloves,
Oh. So you were always in pain, yeah, on and off?
Yes.
Yeah. Mm-hmm.
especially when it rains. I could always tell the pain started coming on strong.
Okay, right now, do you wear gloves anymore?
No, I haven't. I haven't, even when it rains, I haven't had to wear them.
So how long have you been pain-free?
Well, since I've been pain-free since Dr. Elain started the very first treatment.
Yeah. Isela been treated by Dr. Elain. But from the very first treatment, you were
She
able
gave
to...
me shots in both knees because
Yeah.
it was pain. Every night I would put Bengay, but
Yeah.
it never helped.
But after the first treatment, you were able to play the piano,
Yes,
and then now you have not have any pain. We treat you on and off. For,
I'm
yeah.
flexible, I can play, and I can't...
And you don't have to wear the gloves?
No, no gloves. I was wearing gloves even during the night.
Uh-huh.
I knit,
Oh.
when it was cold.
Oh, I see.
Even though Fred couldn't stand the heater, so I put the gloves on.
Okay, so you have not had any pain for the last 3 years.
Exactly.
Okay. How young are you now? You just had your
I
birthday.
had my birthday yesterday, 79 years.
Oh, so 79 years. Wow.
79 years.
So that's terrible. All these years you have pain,
Yes.
cold all the time, and
All the
now you don't have any pain. You're not
I
cold,
couldn't even wear sandals because my feet were cold.
but you're wearing sandal now.
Yes, and I had the gout and arthritis in my legs and my toes, and some of the toes, the bones are out, but I can wear closed shoes. I can wear sandals, and I'm not cold. Even
And you're
if it's
dancing every week with your 90-year-old husband.
Yes, I am.
He is even more incredible.
And we'll be dancing
Yeah.
Saturday because my other daughter in Woodland Hills and my son and his 2 daughters and my other grandson, 4-year-old,
Fantastic.
they're having a party for me Saturday.
Yeah. Anyway, let's talk about the other part, your diabetes. You had
Yes.
diabetes for like 7 years,
7 years. It'll be 7 years next month.
and you were taking pills all the time.
Yeah,
How many pills?
I was taking 3 a day. And
One type.
one metformin,
Okay.
one type.
You okay?
And then I was cut down because Dr. Fujioka, the diabetic specialist, he said, your sugars are excellent because I have to turn in the...
That since we start treating you or no? Before
yeah.
we treat you, so were you able to cut down the metformin?
No.
So until we treat you?
Yes.
Okay,
And
so
then I
you were taking only
exercised.
metformin 3 times,
Yeah,
3 a
every
day
day.
for like 7 years.
I started with 1, then 2 years later they gave me 2, and then 3, and then now I'm just taking 1.
Okay, since we
Since
start
you
treating, okay.
started me.
So I tell you, you should stop it totally.
Yes.
Metformin is just like a band-aid. You treat the symptom and not treat the pancreas.
Right.
We have been improving the circulation, the qi to your pancreas.
Yes.
Now your pancreas is making insulin.
It's been
Okay.
a difference.
You make a big
It is
difference.
big
We'll tell
difference.
them why, okay? And but the thing that everybody should know, they have 2 huge studies. The first one back in the 70s, University Diabetic Group Program. Supposed to go for 14 years. They had to stop 6 years earlier because the oral hypoglycemic, the pill for diabetes, kills people 200 to 300 times death from heart disease. Okay? But doctors continue to prescribe the same thing that kills people that many times. And recently they waste so much money and repeat the same study they called Accord, and they found the same thing. Okay, when you drive the sugar more normal with pills, people die from heart attacks 200 to 300 times. And you know what? Your doctor continue to give you metformin, and everybody continue to prescribe it. So why do all the study? Such a waste, such a waste of time, such a waste of money. Okay, now tell us, so you had
my indigestion has been much better.
exactly. Yeah, we treat the whole thing. We treat everything.
Yes,
Okay.
yes.
Before you came to see us, you were on up to 3 pills on your for your diabetes. How high did your sugar go up to
It
on the
was
3 pills?
255.
255.
Uh-huh.
Okay. Now
And
you're on 1 pill
Yes.
and you eat a piece of cake.
And
pound cake.
The pound cake and everything. I was 135 this morning. I couldn't believe it.
Okay. So
And
that shows that diabetes can be cured just by restoring the circulation to the pancreas. Okay, when the circulation to the pancreas is not restored, you can use all kinds of toxic chemical pills. All it does is you make your heart sicker, make your kidney sicker, liver sicker, and the patient sicker. Okay, so I'm glad that you didn't go away and catch on that.
I was going to say the time that, let's see, 7 years ago that I got the Bell's palsy.
Oh, you got okay.
On the
That's a
left
liver
side.
problem. Yeah.
Yeah. And my eye didn't turn that time because I had it in 1999.
Mm-hmm.
And I didn't know when I got to the doctor. My daughter took me to the emergency at Pomerado Hospital. And then the following week I went to my regular doctor in LA in Van Nuys.
Mm-hmm.
And then he told me, he said, let me take your sugar. I said, I'm beginning to see a little bit blurry.
Your eye.
And that first time, because they put me on steroids at the hospital.
For
They
what?
gave me steroids for inflammation or anything.
That kind of
And it
ridiculous.
raised my sugar to 360. That's why I was seeing blurry and dizzy, you know. And,
Yeah,
and then that's when he said, yeah, I took it so hard that I had diabetes because I really had watched myself because my dad was on insulin.
Mm.
And I knew it's inherited. I
Yeah.
think it's inherited.
Yeah, terrible. So people always say when you're sick, go see a doctor. Not a Western doctor that use drugs all the time. They kill you rather than get you better.
Yeah.
So let's talk about what kind of thing you eat in your party.
Oh, yesterday I had a piece of the raspberry with all the sugar in it. And the cream
Raspberry
cheese
what?
and
Pie?
Raspberry cake.
Cake. Oh,
The
okay.
cake, the yellow cake.
Okay.
And I told my granddaughters, I said, I'll make an exception for my birthday, so you can order my favorites.
Yeah.
Yeah.
And then on top of that, you have a
And then Saturday will be the party. with my other daughter and my.
But you have also a pound cake, you told me.
Yes, that's the pound cake.
And that's
They
very
call it
sweet.
The bunt, they call it the bunt cake. And then
Okay, then this morning, your fasting blood sugar was what?
135.
See, 135, okay?
Mm-hmm.
Eating all those things here, you expect
I
me to
ate the
300.
rice. I ate the rice with the meat and the.
So all these
vegetables.
carbohydrate, okay? Practically, Isela right now is like a normal person, okay?
Mm-hmm.
You can stop the metformin. I promise you, your sugar will not go up, okay? Because your pancreas is working. So you're bringing your daughter and son-in-law
Yes, they're coming in.
and your aunt, okay?
My aunt.
Your aunt had
My
gained.
son is, yes, she gained about 20 pounds since you treated her.
I want to give her one treatment. Yeah, yeah. Bring them all back. Let's celebrate life. Let's
Yes.
celebrate health. Okay,
Yeah,
have a
and
party of health.
she tells me, and I said, no, I said, we're not coming back. She's in an assisted living home. And she wanted me to bring her, but I said, we're going to San Diego from Dr. Tong's, we go back to home.
Yeah,
So my son said, I will bring you, Beatrice, I'll bring you here.
yeah. Anyway, so I don't want you to abuse pies and cake, okay? But you don't have to avoid it like they're poison.
Right.
They are kind of poison, okay? But there are no really truly good sugar cake around.
So that aspartame and the sugar-free pies is
They're
really-
worse. Splenda, aspartame, saccharin, those are worse than regular sugar pie. Okay, but now your pancreas is working much better. You can handle those.
Yes.
So we'll see you next time. You keep on checking your fasting blood sugar and drop the metformin. Okay.
All right.
Yeah. So you don't take any pills anymore.
No more pills.
No more pills. Okay. So right now
Just take
you're much older than before. You're living a lot more, dancing all the time.
Yeah.
Okay. That
Yeah,
is
we are.
more, you know, we're adding life to your ear. The other doctor added ear, but no life to the ear. Yeah. Thank you very much for sharing the
So,
story.
Thank you, doctor.
Okay.